Hello, Manong George here. Welcome to our channel. And today we have a very special guest.
Hi, my name is Roberto De Vera. I'm a nurse by background. I'm currently working as a clinician in 111 service. I previously worked with 999 as a clinician as well.
Sometimes nurses attend our London courses from as far away as Glasgow, Cardiff and Portsmouth. Thank you. Sometimes nurses would like to attend our outstanding OSCE courses but for various reasons can't make it here. It's okay, we hear you. Here at IELTS Medical, we're currently working on reaching every nurse wherever you are in the world. In the meantime though, we've got our video course and textbook package called The Ultimate Guide to the NMC OSCE. Your guide includes the theory for the exam, as well as vouchers for 1 or 2 6-hour sessions with our OSCE educators. Grab your ultimate guide at oscenurses.com today.
And I've been here in the UK for more than 3 years now. I'm a nurse by profession, and it's just like every other Pinoy nurses here in the UK. I started my journey as a nurse in the Philippines for a few years until I moved to the Middle East in United Arab Emirates as a RN. I was then employed by the ambulance service as a 999 clinician in one of their contact centers here in the lower part of the country.
I want you to dial 999.
Until I got promoted as a clinical navigator in 111. So it is a Band 7 role, which involves supervising and being a point of contact for different healthcare professionals in the trust, which may involve doctors, nurses, paramedics, pharmacists, dental nurses, and the other practices that are with the company.
Man knows best.
One of the perks would, of course, because you're working in an office setting, you're just in front of your desk and sitting in a comfortable chair. There's not much physical stress involved, so no more lifting of heavy patients. Goodbye to moving of heavy instruments and stuffs. And you are able to just deal with one patient at a time when you're talking to the telephone. So that's one of the good things. Second is that the office is actually designed to be a conducive place of work. So there's very less noise. There's very few hazards that may cause injuries or different problems. So you're away from those needles, radiations, or infectious diseases that you may get from patients. Also, what I found in the service that I'm working is that there's not much hierarchy involved, so you're able to work on your own as much as you can, and you can be as independent as you can be. But of course, if you needed help, there is always help available. So it is also a multidisciplinary company. So there's a lot of people that you can partner with whenever you're stuck into a decision. So for example, you can consult doctors or pharmacists, our dental nurses, our practitioners. So there's a lot of help if you will really need them. And those are things that can be hard to find when you're working in the hospital.
Man knows best.
For those of our nurses who are used to working into a face-to-face care, it can be quite a challenge to transition to working with your patients over the telephone. First of all, you cannot really select the person that you speak to. So for some reason, for example, you have spoken to a young boy who is with a dying patient. It is very challenging to give them instructions over the phone as to what you need to do, like instructing them basic life support or asking them different questions that they may not be familiar with when you're talking to an older person.
Hello?
Some people are likely to select being less physically stressed, but the type of job that I do can be mentally taxing. So it's very stressful in your mental health, especially when you're dealing with patients who call you when they're in a panic, when they're dealing with stressful emergency situations. And for that reason, sometimes nurses, not only nurses, but all of the staffs that are involved in doing this kind of job receives verbal abuse, harassments, or threats, wherein it's really hard to avoid. Of course, also working in an office setting, you may enjoy being less physically stressed, but the side effects of it to your health and well-being, being it a desk job, you can be stationary. Of course, it depends from person to person.
Manong knows best.
Working in the 999 environment, there's actually a lot of duties and responsibilities involved. As a clinician, one of our main responsibilities would be calling our patients back and performing a triage with them. By doing so, it is important that you be very systematic and not just blindly ask questions out of thin air. For that reason, NHS has actually created what we called the NHS Pathways, which is a tool similar to the Manchester triage system. And for those familiar with it, it is a wonderful tool. So you work your way up for whether a patient may have immediate life-threatening symptoms or emergency medical problems, and then you give them certain advice over the telephone, either it giving them basic life support, Heimlich maneuver, or instructing the patients about taking aspirin if you're suspecting a possible heart attack, and many more, until you reach to a point wherein you either send them an ambulance or referring them to different services nearby the patient's area, either via their district nurses, their GPs, treatment centers, A&E, or different mental health services or dental services that they can contact or go to.
Think they do 999 here?
It is 999.
Another responsibility that we have is, of course, supporting our emergency medical advisors. So, fun fact, they're actually people who you first make in contact when you dial 999. So, they are the first person who do a telephone triage with you over the phone, and whether a patient may have a complex medical need or a different medical history that a non-clinical person may not know. So that's the time when we step in and perform our enhanced triage, which is what I said earlier. We ask them different questions based on what their symptoms are, and giving them or instructing them different procedures that they need to do for patients. So there are many more things that we do in the control room, but because they can be complicated and very long to discuss, I think it's better to just keep it for now with those two things.
Manong knows best.
To our lovely nurses and paramedics who wants to join the ambulance service, we welcome you with open hands. We don't have special requirements to be in the service. So long as you're a registered nurse or paramedic with NMC or HCPC, you're welcome to apply. So after you pass the interview phase, it will take up to 2 to 3 months before you actually work on your own. So that would involve the NHS Pathways training. After the interview, you undergo some mentoring or shadowing with one of our nurses or paramedics in the contact center, and you get evaluated for your competence in working by yourself, and you will be asked whether you're confident enough to take those responsibilities, and that's the time that you get to work by yourself. So I hope that we receive applications from you.
Always remember, Manong knows.
Manong knows best. Put your worries to rest when staying in the United Kingdom. Manong knows best.